The world's biggest cities and urban areas are facing some of the worst air quality. In 2019 alone, more than 1.7 million people died due to the impact of air pollution. The condition in India is even worse. Three major cities of India, Delhi, Kolkata, and Mumbai, are among the top most 20 polluted cities in the world in terms of PM 2.5 levels. According to the State of Global Air report released by Health Effects Institute, Delhi is the most polluted city, followed by Kolkata in terms of particulate matter 2.5 levels in the air, while Mumbai has been ranked 14th on the list. The report provides a comprehensive and detailed analysis of air pollution and global health impacts for more than 7,000 cities around the world, focusing on two of the most harmful pollutants, fine particulate matter 2.5 and nitrogen dioxide. As per the report, cities in Asia, Africa, and Eastern and Central Europe saw the greatest health impacts from PM 2.5 exposures. Hello students, I am Maruthanandan Upadhyay, and in this video, we will talk about the state of air pollution, its impact on health and wellness, and the findings of the State of Global Air Report 2022. This video will be useful for UPSC Mains GS Paper 3, and at the end of the video, you will be given a mains question to practice answer writing. Do remember to take down notes as well, as the data and points discussed in the video will be useful in your UPSC preparation. So, let's start. About the report. The State of Global Air is a collaboration between Health Effects Institute and the Institute for Global Health Metrics and Evaluation's Global Burden of Disease project. The State of Global Air, SOGA, is a research and outreach initiative to provide reliable, meaningful information about the air quality around the world. The report provides an overview of air pollution levels and associated health impacts in cities around the world. This report summarizes data on air pollution exposures and associated health impacts in more than 7,000 cities from 2010 to 2019. This is the first report from the State of Global Air to assess NO2 exposures globally. In line with United Nations definition of a city, only cities with a minimum population of 50,000 in 2019 were included in this analysis. Cities, for the purpose of a study, were grouped into 21 regions as defined by the Global Burden of Disease project. How severe is air pollution? Air pollution is responsible for 1 in 9 deaths worldwide and accounted for 6.7 million deaths in 2019 alone. Of these, more than 4 million deaths were linked to exposure to outdoor fine particle pollution worldwide. Breathing polluted air increases a person's risk of heart disease, lung diseases, and respiratory infection, type 2 diabetes, and more. Mothers' exposure to air pollution during pregnancy can lead to an increased risk of their infants being born too small or too early. Polluted air has also been linked to asthma and lower respiratory infections among children. Exposure to air pollution also shortens life expectancy. These health impacts lead to missed school and work, chronic illness, and death, harming families, communities, and economies. Levels of air pollutants continue to exceed the air quality guidelines established in the World Health Organization (WHO). Almost everyone lives in an area where outdoor fine particle pollution concentration exceeds the WHO guideline for healthy air, which is 5 microgram per meter cube. More than half of the world's population lives in areas that do not even meet WHO's least stringent interim target of 35 microgram per meter cube. And by 2050, almost 68% of the world's population will be living in cities and breathing urban air. Measuring air pollution in cities. Air pollution can be due to various pollutants, and thus measuring it can be a tedious task. Air pollution can be caused by both man-made and natural sources. Man-made sources include exhaust from industries, power plants, automobiles, and even appliances and items of daily use like deodorants, refrigerators, and ACs. The natural sources include volcanic eruptions, leak of gas or pollutants from Earth's interior due to geological activities, and even paddy fields and farmhouses. The report considers two main air pollutants found in cities, particulate matter 2.5 and nitrogen dioxide NO2. Particulate matter 2.5 or PM 2.5 are airborne particles measuring 2.5 micrometer or less in aerodynamic diameter. Anthropogenic or human sources of PM 2.5 include household burning, energy production and use, industrial activities, vehicles, and other sources. Exposure to particulate matter 2.5 can result in cardiovascular or heart diseases, respiratory diseases or lung diseases, and other types of diseases. On the other hand, nitrogen dioxide or NO2 is a gaseous pollutant and a key marker for traffic-related air pollution. It is particularly abundant in cities and urban areas.
NO2 and other nitrogen oxides can also interact with other chemicals in the air to form particulate matter and even damage ozone layer. Combustion of fossil fuels in vehicles and industries is the leading source of NO2. In cities, vehicles are often a major source of NO2, and people living close to roads and highways experience higher NO2 exposures. Exposure to NO2 can aggravate asthma symptoms and has been linked to the development of asthma in children and adults. There is also a considerable evidence supporting the link between long-term exposure to NO2 and deaths. How severe is air pollution? According to the report, particulate matter 2.5 levels in cities ranged from 0.1 microgram per meter cube to 133 microgram per meter cube, with a global average of 34.6 microgram per meter cube. Of the cities included in the report, the most heavily polluted cities are located in Asia, Africa, and Latin America. The report highlights that residents in cities from India, Nigeria, Peru, and Bangladesh are exposed to particulate matter 2.5 levels that are several fold higher than the global average. India and Indonesia have seen the most severe increase in particulate matter 2.5 pollutions, whereas China has seen the greatest improvements. India is home to 18 of the 20 cities with most severe increase in particulate matter and 2.5 pollution levels. The other two cities are in Indonesia. All these cities saw an increase of more than 30 microgram per meter cube during 2010 to 2019. Of the 50 cities with the most severe increase in particulate matter 2.5, 41 are in India and 9 are in Indonesia. Even worse, these cities lack monitoring stations on the ground. According to the 2022 WHO Air Quality Database, out of the 20 cities that saw the steepest increase in particulate matter 2.5 exposures, only 2, Satna and Varanasi in India, have an official monitoring stations. This fact points to the need for improved local air quality monitoring infrastructure worldwide. In 2019, the global median of particulate matter 2.5 attributable death rates in cities was 58 deaths per 100,000 people. Cities in East India reported an average of 106 deaths per 100,000 people due to air pollution. This data for South Asian cities stands at 86 deaths per 100,000 people, and for Central Asian cities it is 78 deaths per 100,000 people. While Eastern Europe saw 78 deaths per 100,000 people and Central Europe saw 77 deaths per 100,000 people. The data clearly highlights that deaths due to air pollution are higher in cities in East Asia compared to that in Europe. In 2019, the global average NO2 exposure was 15.5 microgram per meter cube, but exposure levels varied considerably across cities, ranging between 0 and 68.9 microgram per meter cube. The highest exposure for NO2 was seen in Beirut, and the lowest exposure was seen in Sao Tome. Geographic patterns for NO2 pollution are strikingly different from the patterns seen for particulate matter 2.5 pollution. Particulate matter 2.5 pollution tends to be highest in cities in low and middle income countries, whereas NO2 levels are high in large cities across countries of all income levels. This is mainly due to high vehicular pollution in these cities. Almost all of the most populous cities across 21 regions reported NO2 exposures higher than the global average of 15.5 microgram per meter cube. The top 5 NO2 polluted cities are Shanghai, Moscow, Tehran, St. Petersburg, and Beijing. Globally, NO2 exposures are heading in an encouraging direction as 211 more cities met the WHO guideline in 2019 as compared with 2010. However, 86% of cities included in the report still exceeded the WHO guideline for healthy air in terms of NO2. WHO recommends NO2 levels to be below 10 microgram per meter cube. Interestingly, most of the cities that met WHO guidelines for NO2 are located along coastlines and have weather conditions that may help to disperse NO2 pollution. Example, Suva, Karangasem, and Matwapa. Of the 20 cities with the largest decrease in NO2 exposure between 2010 to 2019, 18 are located in China. The other 2 are in the United States, Los Angeles, and Japan, Tokyo. Cities that witnessed the largest increase in NO2 exposures from 2010 to 2019 include cities in low and middle income countries in North Africa, Middle East, South Asia, Southeast Asia, and Latin America. Ground-based monitoring stations for NO2 measurement are even more scarce than those for particulate matter 2.5 measurement, especially in low and middle income countries. The 2022 WHO Air Quality Database reveals that only 74 countries have official ground-based monitoring stations for NO2, while 117 countries have monitoring stations for particulate matter 2.5 and particulate matter 10. Among the 20 cities experiencing the largest increase in NO2 levels between 2010 and 2019, only 5 have an official air quality monitoring stations, and only 3 of them measured NO2. Way ahead. The United Nations estimates that 2/3 of the world's population will live in cities by 2050, with much of the growth in urban populations concentrated in Asia and Africa. In response, cities around the world are beginning to lead an action to curb air pollution. The good news is that a wide range of cost-effective solutions are already available to reduce pollution from many key pollution sources. These include promoting green and sustainable transportation, expanding access to clean energy for household use, and shifting to clean and efficient energy production. These solutions have the potential to both improve public health and slow climate change, and they are becoming increasingly affordable, accessible, and feasible in countries around the world. It is also crucial that planned interventions and policies include collaborative engagements across governments, researchers, civil society, and other interested parties. By leveraging evidence-based actions that are tailored to the local context, it is possible to create cleaner air for the world's growing urban populations. The key approach to addressing the air pollution in cities is two-pronged. One, we need to measure air quality robustly, and two, the cities need to address the cause leading to air pollution and plan accordingly. Shift to clean and renewable energy resources will help both in mitigating the impacts of climate change and minimize air pollution in urban areas. That's all in today's session. Let's now look at a question for UPSC mains. Compare the state of air pollution in India and the world and discuss the ways to mitigate its impacts. Do remember to write your answers in the comment section below. If the video was informative, like, share, and subscribe. Also, comment us the topic on which you want a detailed discussion on. Thank you.